Okay, so thank you, Professor Distler. So you have a debate tomorrow on combination therapy in systemic sclerosis. So what would be your recommendation regarding this new approach for scleroderma treatment?
I think many of us are using combination therapies, in particular patients at risk of progression, getting severe. And in general, this makes sense. But when we look at the evidence behind combination therapy, it's very limited, particularly in the anti-fibrotic treatments, so including the immunosuppressive treatments, so indications for treating lung fibrosis or skin fibrosis or other fibrotic manifestations. And basically, there's no head-to-head comparison of single versus combination therapy for fibrosis. They are existing for PAH, but not for fibrosis. And I think we are lacking these data, and they are important. They're important because you need not only to guess, but to know whether their efficacy is indeed add-on and not replaced or it's comparable with single. And this is important because there might be adverse events that are doubled, or there's an add-on adverse event profile as well. And if we don't have studies, we don't know this either. And, costs is a sensitive issue, but we also should consider costs of a double therapy, which is much higher. So it makes sense in at-risk patients, but we need much more the evidence data, clinical trials comparing single with combination therapies before we broadly use it. And now it has to be decided on a case-by-case basis.
Okay, good. Thank you very much.